Hi team, good evening all.
Yes, ma'am. Good evening.
Good
It's
evening,
very
ma'am.
good evening. Good
Good
evening
evening,
team.
ma'am.
Good evening. Okay, so team, this is Dr. Menaka. Moving forward, I'll be handling your sessions. So today's session will be about medical terminology. Okay, so let's wait for a few minutes, then we will start so that others can join the meeting. Let's wait for 1 or 2 minutes, then we will start the session. Okay.
Okay.
Okay. And if you're facing any issues in between, you can let me know while when I have started the session. Like if something is not clear or if you are facing any struggles, means you can let me know.
Okay, ma'am.
Okay.
Okay, team. So let's start our session. Okay, so today will be a basic session about the medical terminologies and the pathologies related to our body systems. So in your school level itself, you guys have studied. Yes. Studied about the basic human body, that is the basic organ function, organ system, and its functions. So in today's session, we are going to discuss about the medical terminology and pathology. So what do you know about medical terminology? What is a medical terminology? Whatever you know about medical terminology, you can say.
It is a special language used in medical
Mm,
medical field.
very good. It's a special language which is used in medical field. So, like if you take a common man, so they'll say as that he is having high blood pressure, but a physician will mention it as hypertension. Similarly, if a common man will say, I suffered a heart attack, but in medical terminology, we call it as myocardial infarction. So these are known as medical terminologies. So physicians will use medical terminologies while writing the medical record. So as a medical coder, we should be aware of the medical terminologies and the common pathologies for coding purpose. So that is what we are going to discuss in today's session. Okay, so give me a minute. I'll share my screen. Okay. 1 minute, team. Just give me a minute.
Hello.
Yes, ma.
Yeah, I'm a new joinee. I just joined today, so could you please start over the class? Hello.
Yes, Anju. Yes, ma.
Yeah, am I audible?
Yes, ma, you're audible.
Yeah, I just joined the class today. So could
Okay.
you please start over if some portions are
See,
taken?
we have not yet started the session. Just we have started talking about medical terminology. I have not even started sharing my screen. Just I have
Okay.
asked the question as medical terminology. That's all.
Okay.
Okay. So team, before getting into the session, I just want to know, are you guys freshers or already you guys are exposed to medical coding?
Freshers.
Freshers.
Freshers, ma'am.
Experience.
Freshers,
Yes,
ma'am.
ma'am.
Okay,
Experienced.
experienced as well as freshers. Okay, okay.
Experience.
Experienced.
Half of the members experience, ma'am. All members
Okay.
are
Yes, yes. Okay. So few people are experienced and few people are freshers. Fine.
Ma'am.
So if you guys are experienced means like you guys will be aware of these medical terminologies, I think so, right?
Yes.
So
Yes.
already guys will be experienced with this medical terminology. So uh, so you can take it as a revision, like it will be like a revision, so you can go through the medical terminologies, and if you are encountering any new pathology means, then it will be somewhat helpful in your coding. And for freshers, so no need to worry, we are starting from the scratch. So like we are just starting from the basics, like what is coding and what are the terminologies which we use in coding and what are the books which we are going to use. So everything will be discussed in our session. Okay.
Yeah. Hi, team. My voice is audible. Sorry to disturb you. Team, my voice is audible.
Yes.
Yes,
Yes,
sir,
sir.
you're audible, sir.
Team, my voice is audible.
You're audible, sir.
Yes.
Okay, Manaka, just you
Sir,
can try now.
audible.
Now you can able to share the screen.
Yes, sir. Now I can able to share the screen, sir. Yes.
Okay, Manaka, you can continue the session. I'll be wind up myself.
Okay, okay.
Okay.
Thank you, sir.
Thank you.
Thank you for the
Thanks.
access. Yeah, thank you, sir.
No.
Okay. It's fine. Okay. Team, is my screen visible to everyone?
Yes, ma'am. Visible.
Yes.
Okay, that's good. Fine. So coming to the medical terminologies, physicians will use medical terminologies while writing a record. So if you take a medical terminology, it will have prefix term, root word, and suffix term. So the root word will be mostly it will be a name of an organ, and the prefix or suffix term will either it will tell the pathology of that organ. Pathology means disease, so it will explain about the pathology of that organ, or it will tell the procedure which is performed on that organ. Okay. Fine. So coming to the suffix, so coming to the root words. So if you take root word, cardio means heart. Dermato is a root word which means skin. Aesthetio means feeling or sensation. That's why we call it as anesthesia. An means absence. Absence of sensation is anesthesia. So aesthesia means feeling or sensation. Gyneco means female. Immuno refers to our immune system. Neo or nato means new or birth. That's why we call it as a neonate. Neonate means newborn. Neo means new. Ophthalmo refers to eye. Patho means disease. Radio means radiation. Uro refers to the urinary tract or urine. So these are known as root words. So we are going to discuss a lot of root words. Fine. And coming to the suffix terms. So today we'll discuss the suffix terms related to surgical procedures. Centesis. Centesis means puncturing a cavity to aspirate or to remove fluid. Centesis refers to surgical puncture to aspirate or remove fluid is known as centesis. Example, arthrocentesis. Arthro means joint. So arthrocentesis means puncturing the joint to aspirate fluid. Next, coming to the word ectomy. Ectomy means surgical removal, cutting out and removing. So excision is known as ectomy. Appendectomy means surgical removal of appendix. Gastrectomy means surgical removal of stomach. Hepatectomy means surgical removal of liver. Hepato means liver. So ectomy means surgical removal. Next, lysis means loosening or destruction. Lysis means breakdown or destruction. Example, hemolysis. Hemolysis means breakdown of blood. Hydrolysis means breakdown of water. Next, PEXI means surgical fixation, which means securing a body organ in a fixed position. Securing a body organ in a fixed position is known as PEXI. Next, plasty refers to surgical repair. So assume the patient is having a cut, we are suturing it means it is plasty. Plasty means surgical repair. Next, again, raphy means suturing. Putting stitches is known as raphy. So herniorrhaphy means stitching the herniated region to repair it. Next, cardiorrhaphy means suturing the heart. So raphy means putting stitches. Next, scopy refers to visual examination with the use of a lighted instrument. Example is endoscopy. It's a general term, team. Endoscope is a general term. Endo means inside. Endo refers to inside. So endoscope means instrument to view inside of our body. According to the body organ which we are inspecting, the name of the scope will differ. Example, laparoscopy. So laparo means abdomen. The medical term, laparo means abdomen. Scopy means lighted instrument to view. So instrument which is having camera and light source. Next, ostomy. Yes. Any issues? Ostomy refers to an artificial opening. Ostomy refers to creating an artificial opening, or anastomosis also ostomy only. Anastomosis means connecting two cut ends. Connecting cut ends is known as ostomy, or creating a new opening is known as ostomy. Example, colostomy, tracheostomy, and hope you have heard about this gastrojejunostomy, gastroduodenostomy, like this. So ostomy means either creating a new opening in the body or connecting two cut ends of a tubular body part is known as ostomy. Okay, so I can note down this so that I can proceed with the next page. Guys, any doubts in this?
No, ma'am.
If you face any issues in this, you can let me know. I'll give you 1 minute time, then I'll proceed with the next page.
Excellent.
Yes, ma.
Vaccine.
Next page.
Surgical fixation. Madam, surgical fixation means?
Surgical fixation you are asking, right?
Yes, ma'am.
Okay. So, let me show you a picture and I'll explain. Just give me a minute. I can take. So, hope you have heard about nephroptosis. Ptosis means drooping, that is falling down or moving from the actual position is known as ptosis. So, if we are again putting it back to its position and we are suturing, we call it as nephropexy. So, putting an organ in a suitable position and securing it so that it can't move further, we call it as pexy. So here you can see the kidney is drooping from its actual, drooping means falling, that is it is moving down from its actual position. So the treatment option for this is again we'll put it back in its position and we will suture it so that it will not move down. This is what we call it as pexema.
Done, ma'am.
Okay. Next one. Coming to tome. Tome means instrument to cut is known as tome. Instrument for cutting is known as tome. Example, osteotome. Osteotome will help in cutting the bone.
Bone.
Yes, good. Dermatome. Any idea about dermatome?
Skin.
Very good. So dermatome will help in cutting the skin.
Skin.
So tome means instrument to cut. Next, otomy means putting incision. O-T-O-M-Y. Otomy means putting an incision. That is making a cut is known as otomy. Simply making a cut is known as otomy. O-T-O-M-Y. Next, tripsy means surgical crushing. Yes. Tripsy means nothing but crushing, which is nothing but breaking the stone into small pieces. Litho means stone. Lith means stone. So lithotripsy means breaking the stone into small pieces.
Can write, you can note down in notebooks.
What, ma?
You can note down in notebook.
Ah, yes, you can note down.
Can
I'll
start.
wait. Yeah, yeah. Yes, you can.
Yeah, wait.
Yes. Have you done?
No.
Okay. I'll wait.
Hello. Ma'am, your good name?
My name Dr. Menakaba.
Okay, okay. Actually, I'm having client call right now. I'm leaving the session. Is it available in app, right? This today's session?
Yes, the recorded session will be available. I think the session is getting recorded. Yes, then it will be available. Yeah.
Okay, okay. Thank you.
Okay,
Yeah.
okay, can leave the call. Team, have you done?
Yes, ma'am.
Yes. Okay. Okay, then fine. Let's move on to next set of medical terminology. This is about body structure. Adeno means gland. Adeno refers to gland. Angio refers to vessel, blood vessel. Bio means life or living. Bliparo means eyelid. Cerebro or encephalo means brain. Next. Colo refers to colon, that is large intestine. Next. Facio refers to face. Hepato means liver. Mammo or masto refers to breast. Musculo or myo refers to muscle. Myelo means bone marrow or spinal cord. For both, we are having a common medical term, myelo. Myelo it refers to bone marrow, which is present inside the long bones, and bone and spinal cord as well. Next, osteo means bone. Pulmono or pneumono means lung. Tonsillo refers to tonsils. Tracheo refers to trachea. Vaso means vessel, just blood vessel. Okay, you can note down this.
Scroll down above page. Edema starting. Scroll.
Done, ma'am. Okay, so let's proceed with next one. So next suffix term related to a symptom or a diagnosis. Algia or dynia refers to pain. Yes, algia or dynia refers to pain. Seal means protruding out. Seal refers to herniation or protruding out. Next, ectasis means dilation. Ectasis refers to dilation. Edema refers to swelling. Edema refers to swelling or fluid accumulation. Emesis refers to vomiting. Emesis refers to vomiting. Next, anemia refers to condition of blood. When we are going to talk something about blood, it will end with anemia. Example, anemia. Anemia refers to decrease in number of red blood cells in blood. Next, polycythemia, hyperglycemia. So hyperglycemia means excess glucose level in the blood. So anemia refers to condition of blood. Next, iasis means condition. Iasis refers to condition. Next, itis refers to inflammation. Itis refers to inflammation. Inflammation means a swelling. Example, hepatitis. Hepatitis means inflammation of liver. Next, lith means stone. Lith. Lith means stone. Not ith, it is lith. Lith, lith means stone. Next, Malaysia means softening. Example, nephromalacia. So nephromalacia means softening of kidney. Chondromalacia means softening of cartilage. Because chondro means cartilage. Mania means excessive preoccupation. It is fear of some, not fear, like excess of something. Example, pyromania. So pyro means fire. So putting everything in fire is pyromania. Megaly refers to enlargement. Megaly refers to enlargement. Shall we move on to next one?
Yes.
Okay. So oid refers to resembling. Example, humanoid. Now, nowadays they are saying it, humanoid robots. So humanoid means similar to human. So oid refers to resembling, similar to. Oma refers to tumor. Tumor is nothing but abnormal growth of cells. Oosis means condition. Pati refers to disease. Penia refers to deficiency. Phobia refers to abnormal fear. Next, ptosis means drooping, prolapse, or sagging. Example, nephroptosis, which I have shown, right? So the kidney has moved from its actual position, prolapsed kidney. So, okay, so ptosis means drooping. Next, regia means excess bleeding. Regia refers to excess bleeding. Ria means flow or discharge. Example, otorrhea. So oto means discharge from the ear. Rhinorrhea means discharge from the nose. So rhea means flow or discharge. Pyorrhea means pus discharge. Pyo. Pyorrhea means pus discharge. Next, rhexis means rupture. Rhexis refers to rupture. Spasm refers to muscle twitching or cramping. Stasis means stopping or controlling. Okay, fine. These are all about numbers. This one you should know. Hyper means high, hypo means low. Hyper refers to high, hypo means low. Poly means many. Nulli means none. Pan means all. Example, pancytopenia. Pan means all. Next. Primi refers to first. Primi means first. Next. Ante or pre means before. Example, preoperative. Antepartum. Antepartum means before delivery. Peri means around. Peri refers to around. Example, pericardium. Yes, good. Pericardium. Contra means opposite. Example, contralateral. Contralateral means opposite side. Dia means through. Diameter, we are saying, right? Ecto, exo or extra means outside. Endo means inside. Epi means above. Example, epidermis. Next, hypo or sub means below. Next, inter means between. Example, intervertebral disc. Because the disc is present in between each vertebra, so intervertebral disc. Intra means within. Next, ipsi means same. Next, meso or mid means middle. Next, per means through or across. Example, percutaneous, through skin. Next, supra means above or beyond. Next, trans means across. Trans means across. Okay, so that's all about the prefixes. A or an refers to absence. A or an refers to absence. Then coming to the colors, you need to know about cyano. Cyano means blue. Example, cyanosis. Cyanosis means bluish discoloration of skin. Because of lack of oxygen, patient will get the bluish discoloration of skin. Next, erythro refers to red. Erythro means red. Example, erythrocyte means red blood cell. Melano means black. Example, melanin pigment. So melano means black. Okay. What is this? Okay, team, let's move on to the specific body system and its pathology. So let's talk about, shall we start from digestive system? A very simple system which we are studying from our 5th and 6th standard. Shall we start with digestive?
Yes.
Yes.
That's good.
Okay.
So team, hope you are aware of the basic anatomy. So I don't want to emphasize on the basic anatomy. So what we'll do is, let's proceed with the pathology part. Okay. Okay, let me give you a quick outline on the anatomy. So, yeah, as you guys know, the food enters the oral cavity where our teeth grind the food and saliva helps in lubricating the food. Further, the saliva contains salivary amylase, which starts the digestion of carbohydrate. So the function of digestive system is to break down the food into small particles and to convert this to the micromolecules so that the micromolecules will be absorbed by our body. So the food we consume contains carbohydrates, proteins, and fats. The carbs will be converted to glucose. Fats will be converted to triglycerides, and the proteins will be converted to amino acids at the end of the digestion. Then these things, that is the triglycerides, amino acids, and the glucose will be absorbed by our body, which will be used for the various body activities. So the digestion of carbohydrates starts from the mouth itself. The saliva contains salivary amylase, which starts the breakdown of carbohydrate. Further, the saliva helps in lubricating the food. Next is the pharynx, which is the throat region. This acts as a common pathway for both food and air. Next is the esophagus, which is otherwise known as food pipe. Then from the food pipe, the food will enter the stomach. So there is a sphincter muscle between the esophagus and stomach. Sphincter is nothing but it's like a valve. So this prevents the backward flow of food and acid into the esophagus. The sphincter is known as lower esophageal sphincter or cardiac sphincter. Then in the stomach, HCl will be produced, hydrochloric acid will be produced, which further breaks down the food. Then the food will enter the duodenum, which is the first part of small intestine. So after stomach, the food will enter the duodenum. So coming to the food will enter the small intestine. Small intestine has three parts: duodenum, jejunum, and ileum. So this in this duodenum, food will be mixed with bile juice and pancreatic juice. Bile is produced by the liver and it will be stored in the gallbladder. From gallbladder, the bile will be released. Bile helps in emulsification of fat. Bile helps in fat breakdown. Then the pancreatic juice from pancreas will enter the duodenum. So the purpose of pancreatic juice is to neutralize the acidity of the food, because already stomach has secreted HCl to break down the food. Now this acid needs to be neutralized. So then pancreatic juice will produce buffers to neutralize the acidity. So all this will get mixed up in the duodenum, and the majority of food absorption takes place in our small intestine. That is duodenum, jejunum, and ileum. The majority of food absorption will take place. Then from the ileum, the food will enter the large intestine, which is otherwise known as colon. Large intestine means colon. So the colon has 5 parts: cecum, ascending colon, transverse colon, descending colon, sigmoid colon, where water will be reabsorbed. Then the food will enter the rectum. Rectum will store the fecal matter and it will be defecated through anus. So coming to the pathology. Anorexia. So anorexia. Orexia means appetite. O-R-E-X-I-A. Orexia means appetite. An means absence. So anorexia means lack of appetite, lack of hunger. Next. Ascites means fluid accumulation in the peritoneal cavity. It is our abdominal cavity. Constipation. Difficulty in defecation is known as constipation. Next. Diarrhea refers to loose, watery stools. Next. Dysphagia means difficulty in swallowing. Dysphagia. See, phagia means swallowing tea. Dys means difficulty. So dysphagia means difficulty in swallowing. Gastroesophageal reflex. So the gastroesophageal reflex is nothing but acid. Because of the weakness of the lower esophageal or cardiac sphincter, acid will splash into the esophagus. Next term. Hematochezia means bright red from the rectum. Bright, that is red blood from the rectum. blood from the rectum is known as hematochezia. Next, jaundice refers to yellowish discoloration of skin due to high levels of bilirubin in the blood. Bilirubin is nothing but breakdown product of red blood cell. Next, melena means black stools. Next. Anal fistula. Anal fistula means nothing but abnormal opening is known as fistula. Abnormal connection is known as fistula. Yeah. You can see this is normal anal opening, but inside you can able to see one more opening, right? This abnormal opening is known as fistula. Next, colonic polyp. Polyp means nothing but a tumor with a stem attachment. A tumor with a stem attachment is known as polyp. Next, colorectal cancer, malignant tumor of the colon and rectum. Next, Crohn's disease. So Crohn's disease is a chronic inflammation of the intestinal tract. Chronic means it will be present over a period of time. It's not sudden onset. Over a period of time, inflammation will be present. Next, diverticula means outpouching of the intestine is known as diverticula. in this way, outpouching of intestine is known as diverticular. This is a pathological condition, not a normal one. Hmm. Hmm. So this is a normal colon, whereas if outpouching is present, we call it as diverticulosis. So in this outpouching, if food got trapped and it got infected, means it is diverticulitis, because itis means, it's infection and inflammation is known as. Yes, this is normal. This is outpouching, and in this outpouching, you can see there is infection and inflammation. Next, dysentery refers to painful stools with blood or mucus. Next, esophageal varices, hemorrhoids. Before that, I will explain varicose vein. Okay, so team, our veins will have valves inside it to prevent backward flow of blood. Arteries will not have any valves, while our veins will have valves inside it to prevent backward flow of blood. If this valves inside the vein become weak, it result to backward flow of blood and blood will get stagnated, which we call it as varicose vein, where the vein will give a twisted appearance like this. Because of the vein will get dilated because of blood stagnation, and it will show a twisted appearance. So this will occur for people who are having long standing jobs, like those who are standing for 10 to 12 hours per day are prone to get this varicose vein. So if this varicose vein occurs in the anal region, we call it as hemorrhoids. So if patient is having constipation over a period of time, prolonged period of chronic constipation, if patient is having that, then for each and every time when he want to defecate, he need to apply extreme pressure, which causes damage to the veins over there, which result in hemorrhoids. If the same concept happens in the esophagus, that is, if patient is having difficulty with swallowing, so as a result, the patient is need to give extreme pressure for that. So the veins in the esophageal region will damage, which we call, which result in esophageal varices. Next, hernia. Hernia means nothing but yes, protrusion of an organ through a weakness. If a body organ protrudes out, we call it as hernia. Ileus refers to intestinal obstruction. Next. Ulcer means open sore. Next. So ulcerative colitis is nothing but colitis means inflammation of the colon, large intestine with presence of ulcer as well. Next. Liver cirrhosis. Chronic disease of liver with degeneration of liver cells. Next, gallstones, presence of stones in the gallbladder. Okay. Yeah, team. So we have completed one system. We have started with one system. So moving forward, we'll discuss the other systems. Any doubts in today's session, team? Team, any doubts today?
So, hi,
Ma'am,
what
can
all
I get
things will be
this
covered in
material, ma'am?
each system?
Wait, but one by one, yes. Anju?
Yeah, when we study a system, what all things will be covered related to IPDRG,
See,
pathology,
we have
and
not yet entered into IPDRG, ma. So just the outline, basic anatomy we are dealing now. This
okay,
anatomy and pathology will help you in code leading because
okay,
we are going to work with the medical records, right? So you should be aware of these basics. Yes,
okay.
Asrat Hussain, you have started saying something. Yes, Arsad Hussain.
Ma'am, can we get this study material in WhatsApp?
So study material we will provide in the app. In app, we will give you the record study materials we'll provide.
Okay.
No, actually, we are not getting anything. Actually, it is showing fully blank.
We will provide you.
Okay, okay.
Okay, ma'am,
Okay.
that's it.
Yeah,
No
okay,
doubt.
okay, team. Then that's all for today. Thank you, team. We'll wind up. Yeah, bye.
Thank you, ma'am. Good night,
Bye,
ma'am.
good night.
Yeah, good night. Bye.